Hi everyone, this is Dr. Deepika Tikku, and in this particular video I'm going to talk about four important questions which are asked in the exams, and I'll try to explain them, and they're interrelated to each other. The first one is they're all from the ANS, that what is the biphasic response with epinephrine. Then they ask you in relation to this, what is vasomotor reversal of tail? Connected to that, what is the management of Pheochromocytoma? And the fourth important question, why beta blockers are not given before alpha blockers in Pheochromocytoma? So we'll be trying to answer all these questions in this particular video itself. Please make notes that it is a very important question. So let's get started with the biphasic response with epinephrine. So we know epinephrine, और दूसरा नाम इसका क्या है, that is called as adrenaline. So remember, adrenaline starts with an A, which means it acts on all the receptors, which is alpha 1, alpha 2, beta 1, beta 2, and somehow beta 3 also. On the other hand, noradrenaline means it doesn't act on all, not all. NA is not all, which means it acts on alpha 1, acts on alpha 2, and acts on beta 1, but does not act on the other receptor. So this is a basic difference between these two. Now let's come to adrenaline on the epinephrine and how does it affect the blood pressure. See, when you're talking about the blood pressure, we are talking about two main receptors. One is your alpha 1 and one is your beta 2, right? So alpha 1 and beta 2. So what happens when alpha 1 is stimulated, it leads to vasoconstriction, and when beta 2 is stimulated, it leads to vasodilatation. So remember, a way to remember this is A, B, C, and D. A is alpha, alpha causes vasoconstriction, B is beta, and beta causes vasodilatation. Easy way to remember this, and no confusion. So now, what I want to highlight here is that these beta 2 receptors, they are very, very sensitive receptors. And what I mean by sensitive receptor is that even a small amount of dose of epinephrine can stimulate these receptors. While alpha 1 receptors, they are strong receptors and their action is predominant. और predominant का मतलब है कि when you give a large dose, only then they will be actually affected. And large dose जब देंगे तो alpha 1 भी effect होगा, beta 2 भी effect होगा. But predominant action किसका आएगा? Alpha 1 का, because they are stronger and more predominant. So at a higher dose, so let's say you are giving just 5 milligrams of the dose of epinephrine. That is a very small dose of epinephrine दिया. So it will only act on the beta 2 receptors. But if you give a higher dose, let's say you have now given 20 milligrams of epinephrine here, it will also act on alpha 1 as well as on beta 2. But remember, because their action is predominant, so more of alpha 1 action, that is vasoconstriction, will be seen. And at a lower dose, more of vasodilatation will be seen, right? So if I talk about the biphasic response, so what happens, let's say you're giving an injection of epinephrine and you're injecting directly into the veins, IV injection diya, and it's a high dose, you are giving 20 milligrams. Let's say you're given IV. So 20 milligrams ऐसे आ गया, ठीक है? This is 20 milligrams. So this 20 milligrams alpha 1 पे भी act करेगा. This will also act on the beta 2. But क्या effect आएगा? Predominant action होगा alpha 1 का, and that is vasoconstriction. And vasoconstriction means what happens to the blood pressure? Increase in blood pressure. So you see a rise in the blood pressure. So अगर हम यहाँ पे plot करते हैं, आपने epinephrine दिया 20 milligrams, because of the predominant alpha 1 effect, there is going to be the rise in BP. So let's say it is 160 or 180 millimeters of mercury. So this is the rise in BP. Now, over a period of time क्या होएगा? ये drug will be metabolized, reuptake होता रहेगा. So level इसके आप body में कम होते रहेंगे. So let's say the level of epinephrine will start now decreasing. So when the level of epinephrine decreases, धीरे धीरे क्या होगा? When this much amount of epinephrine is left. See, only beta 2 are there because ये sensitive है, small dose रहेगी, let's say 5 milligrams ही रहेगी है. अब alpha 1 तक तो ये पहुंच नहीं पा रही, ये सिर्फ बीटा 2 पे इफेक्ट करेगी. एंड जब स्मॉल डोज इसकी डोज कम रह जाएगी बॉडी में, ओनली बीटा 2 इफेक्ट इज सीन, एंड दैट इज योर vasodilatory action. And vasodilatory action means decrease in the blood pressure. So here if we plot again, there was an increase in BP 160 milligrams, so slowly it is getting metabolized and the level is going down. So one time जब level इतना आ जाएगा इसका, there will be only effect of beta 2, so it will go further down. So maybe it will go to 50 millimeter of mercury. And when the whole of epinephrine is gone, so there is no more action of epinephrine on either the alpha or the beta receptors, your blood pressure will go back to the normal. Right? So this is the response seen with epinephrine, high dose of epinephrine. So you know there's one phase of response, there's a second phase of response. That's why this is called as a biphasic response. I hope I'm clear on this, right? So this is the biphasic, very important question. What is the biphasic response? So this is because of alpha 1 and this is because of beta 2 stimulation. Now, what is vasomotor reversal of Dale? So what happens when this effect is getting reversed? Dale इसलिए कहते हैं because the scientist Henry Dale, H.H. Dale, he found this effect of epinephrine. So how is the effect of this, the high PP reversed? So if you have given a drug which is an alpha blocker, so let's say we draw a non-selective alpha blocker, I gave like this. So now I have given a non-selective alpha blocker over here. मैंने patient को दे दिया. For example, I give phenoxybenzamine and it's an irreversible blocker. Phenoxybenzamine I given to the patient. Now again I repeat epinephrine injection to this patient. So let's say again the epinephrine levels here are 20 ही दिए मैंने, same 20 milligrams. So the levels are like this, like this, like this, like this, like this. But what is the difference now? The difference is that this alpha is not available because यहाँ पे क्या लग गया आपका, here let's say करते हैं phenoxybenzamine इसके ऊपर बैठ गया. ठीक है? So this alpha is no more available for its action of vasoconstriction. So whatever epinephrine is there, अब beta receptors merge करेंगे with all this epinephrine. So there is going to be so effect of only beta 2 effect. So only effect when you give epinephrine again here, you will see just the fall in the BP, right? So only fall in BP is there when you have given phenoxybenzamine and then when you again repeat epinephrine. So this is called as vasomotor reversal phenomena हो गया, ठीक है? So it has been reversed. So only fall in BP is seen. So I hope I'm clear. So this is vasomotor reversal of Dale, right? So fall in BP only when you give a alpha block. Now treatment of pheochromocytoma. Now why do I want to discuss pheochromocytoma here? See, because what happens in we are going to relate these two conditions. In pheochromocytoma, there is tumor. And there is tumor, let's say, of this adrenal medulla. यहाँ पे tumor है adrenal medulla का. So there is lot of adrenaline and some amount of noradrenaline being secreted, and these levels are really high in the blood. So what happens, adrenaline हमने बात की, on the blood pressure पे क्या होएगा? Alpha 1 and beta 2. It will act on both. But because there is high level of this drug, so predominant effect is of the alpha 1, which is vasoconstriction, and patient lands up in hypertension. So how will you immediately treat the patient? आपको patient को treat कैसे करना है? That you want to bring down the blood pressure. See, actually ये tumor है, तो tumor का जो इसका cause है basically, जब तक आप उसको treat नहीं करोगे, ये तो symptomatic treatment है blood pressure को treat करना. So ideally इसका treatment क्या है? आप resection, surgery करते हैं और tumor को remove करते हैं. But because when the levels are so high, we cannot immediately perform the surgery. So पहले हम blood pressure को we'll get it to a lower level. And how do we get it to a lower level? We have to combat this effect. Alpha 1 को block करना पड़ेगा. So alpha 1 को block करने के लिए क्या drug है हमारे पास? You can give here, yes, your phenoxybenzamine. So when you give phenoxybenzamine, it will take care of the alpha 1 effects. So these high levels of catecholamines are no longer able to increase your blood pressure. But problem kya hai? Ab they are going to act on the beta 2 receptors. So when they only act here on the beta 2 receptors, there can be really a drop in the blood pressure. Hypotension हो जाएगा. और दूसरा, अब सिर्फ बीटा 2 पे तो एक्ट नहीं करेंगे, they will also act on the beta 1 receptors which are present in your heart and they lead to increase in the heart rate. Tachycardia, arrhythmias can occur in these patients. So in Pheochromocytoma, not only do we give an alpha 1 blocker or alpha blocker because they are non-selective, we give an alpha blocker, but we also give a beta blocker so that there is no hypotension and there is no tachyarrhythmias. Okay, so the role of beta blockers is to block any kind of hypertension or any kind of tachyarrhythmias, and alpha blockers, definitely they're going to block the vasoconstrictor effect, so they are going to get down your blood pressure. Ultimately, जब BP levels थोड़े control हो जाते हैं and we take the patient for surgery. So this is the treatment. And the fourth most important question जो था, why we give alpha blocker पहले और beta blocker बाद में? उल्टा क्यों नहीं करते कि पहले beta blocker देते हैं फिर alpha blocker देते हैं? There is a reason for that. And the reason is very simple. If you give a beta blocker first, okay, what will happen? If I go back to this diagram again, if you block, let's say I block it with this. If you block this first, what will happen? जो भी कैटेकोलामीन वहां पे है आपकी बॉडी में बिकॉज ऑफ फेओक्रोमोसाइटोमा, ये सारे का सारा जो आपका कैटेकोलामीन है ये इधर चला जाएगा. इट विल एक्ट ऑन द अल्फा 1 बिकॉज दिस इज लाइंग देयर इज नो ब्लॉकर. सो पेशेंट को और ज़्यादा हाई ब्लड प्रेशर, पेशेंट इज लाइनिंग इनटू हाइपरटेंसिव इमरजेंसीज. So can you imagine this? Can you see this? So if you give a beta blocker pehle, there will be unopposed action on the alpha 1 receptors which will lead to immense increase in the blood pressure. So never ever give beta blockers before an alpha blocker. That is very important to remember. So beta blockers never first. So the reason why don't you give beta blockers first before the alpha blockers? The reason is very clear, that because if you give beta blockers, the alpha action is going to be unopposed and there will be going to be a drastic increase in the blood pressure of the patient, right? So we've covered the 4 most important questions in this particular video. The first is, what is the biphasic response? This is your biphasic response, alpha 1 induced vasoconstriction causing increased blood pressure and beta 2 induced vasodilatation causing decrease in blood pressure. Because beta 2 are more sensitive, alpha 1 are more stronger or predominant in action. The second important thing was your vasomotor reversal of Dale, which was actually seen by, or the first it was identified by Sir H.H. or Henry Dale, and he found out like if you give a phenoxybenzamine, an alpha non-selective alpha blocker before and repeat epinephrine after that, because there is no alpha 1 receptors present, the only effect would be on the beta 2 and that will lead to fall in the blood pressure. So the vasomotor reversal has occurred here. Third is the treatment of pheochromocytoma. Because why is this epinephrine action important to us? Why we want to remember it? Why we want to study it? Because high levels of catecholamine in the body because of a particular tumor, which is pheochromocytoma, again can have the effects on the alpha receptors as well as the beta receptors. But high dose हमने बात की, it will act on the alpha 1 predominantly. Action of predominant जिसका आएगा वो alpha 1 का आएगा, beta 2 का नहीं आएगा. So there will be excessive increase in the blood pressure and उसकी treatment के लिए, so you give this alpha 1 blocker. And when you give an alpha 1 blocker, the blood pressure जो है vasoconstriction part cover हो जाएगा, there will be decrease in BP. But problem क्या है, जब इतना सारा circulating कैटेकोलामीन है, अब वो सारे का सारा बीटा 2 और बीटा 1 पे एक्ट करेगा. सो बीटा 2 पे जब वो एक्ट करेगा, जो तो ब्लड प्रेशर है इट कैन गो रियली डाउन. ठीक है, सो इट कैन गो, लेट्स से रियली इट कैन गो इवन दिस 20 तक, 10 तक. सो हाइपोटेंशन ज़्यादा चांसेस है. सो यू डोंट वांट दैट. एंड सेकेंडली, बिकॉज ऑफ द इफेक्ट ऑन बीटा 1 देयर कैन बी tachycardias and arrhythmias. So we also give a beta blocker alongside. But कैसे देना चाहिए? पहले अल्फा ब्लॉकर दो और फिर बीटा ब्लॉकर दो. नेवर गिव अ बीटा ब्लॉकर बिफोर एन अल्फा ब्लॉकर लेटर, बिकॉज If you give a beta blocker beforehand, alpha is unopposed and only vasoconstriction, increase in the blood pressure, and that will be very, very dangerous for the patient. So I hope I have cleared all these 4 questions for you. And if you like the video, please hit the like button, subscribe, and thank you so much.